Hi, this is Glenn Gruby with the Functional Health and Acupuncture Institute, and today we're going to talk about stress. And it's important that you understand stress and how big of an impact that has on your health. And if we don't have the tools to make positive changes in the way we handle stress, it can be difficult to have optimal health and recover from chronic conditions. So we all hear about genetics, especially with autoimmune diseases, but there's an emerging field called epigenetics, which really looks at the factors other than our genes and how much of an effect they have on whether we are going to manifest a disease. And there's a few things that we look at in particular when we talk about epigenetics, and that would be diet, exercise, and our stress levels. And so today we're going to focus on the stress aspect, but together these three aspects of epigenetics account for 75% of the risk factor that we have in terms of getting chronic disease. So what is stress? Really, it's anything that disturbs an individual's physical, emotional, or mental balance. The body has numerous stress response mechanisms, and stress can affect the body in many different ways. Stress can affect each individual differently. It can cause a headache for one person and digestive troubles for another. And sometimes it's hard to consider that stress is directly related to a particular ailment, but we'll talk more about that. Not all stress is bad. It's actually a normal part of life. There are some good stresses like getting married, having a baby. Even though that can be stressful, those are good parts of our life. But what really matters is how much stress, what kind of stress, and ultimately how each individual handles stress. So everyone is different. Everyone has a different capacity to handle stress. You might have a small bucket for stress and another person might have a large bucket, meaning you might not be able to handle as much stress as another person or vice versa. So the same stress load is not going to have the same impact on every individual. So that's important to remember. If you think that someone in your life is suffering from what you might consider a lower level of stress, to them it might not be a low level of stress. It might be more than they can physically handle. And so the tools of coping with that and managing that become important. So there's many different types of stress. Really, we look at three particular areas: mental stress, often connected to work, financial issues, and emotional stress together, relationship issues. Then there's physical stresses. Physical can be hurting yourself, physical pains, or even doing too much exercise is a stress on the body. And then there's environmental and chemical stresses. These can come from our environment, such as toxins in the environment, but also from our food, poor eating habits, and also chemicals and artificial substances in our food itself. All three of these affect the body pretty much in the same way in terms of the stress response that is created within the body. There are some other common stressors we don't often think about as stress that are related to our environment that we have some control over: food intolerances, smoking, anemia, gut infection, poor digestion, poor meal timing and blood sugar control, pain, and autoimmune diseases. And these are things that we talk a lot about in a thyroid course. And the important thing here is that all of these factors need to be investigated if we are having an unusual stress response. All of these may cause the body to exhibit a stress response that then can predispose us to chronic illnesses and chronic disease. So it's a fact, every stress leaves a scar, and the organism pays for its survival after a stressful situation by becoming a little bit older. This is said by Hans Selye, and he is considered an early pioneer in the research of stress. And basically, stress ages you, no secret there. So we need to really pay attention to the idea that stress is a leading cause of disease and aging. Stress can impact any part of the body and produce physical and emotional symptoms. Studies report that 70 to 85% of all diseases have stress-related factors. To understand the stress response, you must understand why it exists and realize that it's a calculated response to the environment and perception. So stress is important to keep us alive. It's a necessary response of the body. However, our bodies really weren't designed to handle stresses as we see in the modern day. Stress is the underlying cause of virtually all illnesses. So we're going to look here at the progression of stress, and this is represented by cortisol levels in the body. Cortisol is a hormone that is secreted by the adrenal glands, which are little glands that sit on top of the kidneys in the back, and they produce this cortisol in response to stress. One of the important functions of cortisol is to elevate your blood sugar. It causes your blood sugar to rise so that we have adequate fuel and energy for our brains and our muscles to do things when we're in an emergency situation, like run away from the tiger. However, our bodies are designed to have short-term stresses, not long-term chronic stresses. So in our modern day life, we find that after having constant exposures to stresses, we get into an elevated level of cortisol production, what we call stage 1 adrenal fatigue, where we're overproducing. And then the body starts to decline in its ability to produce that in stage 2, and then eventually we get into stage 3 or adrenal failure, where we are producing low levels of cortisol, and this you can often see in patients that have autoimmune diseases or chronic fatigue or fibromyalgia, where the body just cannot keep up with the demands that it previously could have. So typically, it's very common that the adrenal stress response is the starting point for chronic disease. And in perhaps 95% of chronic health issues, it might go something like this. We have stress hormone increases, usually because of some stressful event. It can be death, divorce, childbirth, or overwork. And this has an effect directly on many systems of our body, but primarily on our gut. We have a decreased immune response, so we know that 80% of our immune response or our immune system is located in the gut, and this decreased immune system can allow things like infections to take hold, food intolerances to occur, leaky gut to occur, and this can occur over a long period of time or it can occur in a short period of time. And all of this creates further inflammation in the body that must be then detoxified by the liver, but that system can get overwhelmed and we've increased our body's ability to handle these toxic loads and we fall into a state of chronic disease. You can see here the adrenals affect so many different aspects of our health, from our brain health to our cardiovascular system to our blood sugar levels to muscle and joint pain. Every aspect of our health can be negatively affected when our adrenals or our stress response are not normal. So what are the effects of high cortisol? We have a degradation of the hippocampus, which is the part of the brain that is the seat of the learning and memory. So literally, cortisol, when it is chronically high, starts to affect our brain's ability to normalize things and can affect our memory, but it also affects what's called the hypothalamus pituitary adrenal or ovarian adrenal axis. So the signaling from the brain to other glands in our body can be disrupted when there is a chronic state of high cortisol. Decreased bone formation causing osteopenia, impairs proper sleep and energy patterns, thins the lining of the gut, which can cause it to leak, and we've talked about leaky gut, slows down digestion, can cause digestive issues, increases sodium retention, causing high blood pressure, and it also depletes a number of minerals and vitamins and cofactors that are important for proper neurotransmitter production, proper brain function, proper thyroid function. So it really has a profound impact on all of our regulatory systems of our body. Some signs of adrenal dysfunction. You can see here excessive fatigue, neck and back pain, hair loss, irritability, poor immune response, insomnia, cravings, headaches, depression, indigestion, lightheadedness, lack of concentration, anxiety, food allergies, dry skin, poor memory. One that's important to recognize is if you get lightheaded when you stand up. If you get up from sitting or laying down and you feel dizzy, that can be a sign of poor adrenal function. And many of these things can be caused by other things, of course, but it's important if you're not getting better to look at, is the adrenal system part of the root cause? So obviously we want to look at the effects of stress on the thyroid. It negatively affects production of thyroid hormones. It can be difficult for the brain to signal to the thyroid to make the right hormones if your stress response is not normalized. Stress can interrupt the body's conversion of inactive T4 hormone into the active form T3, making it unusable. So even though your thyroid might be working just fine, your body might not be able to convert it to the form that the body requires. Stress can also make the body resistant to the thyroid hormone even if the conversion is working properly. And all of this can happen even if your thyroid lab tests appear normal. So if everything on your labs look normal but you're still not feeling well, then we want to look at what's the state of the stress response. An overactive stress response can lead to many diseases: diabetes, cardiovascular, high blood pressure, elevated fats, stroke, GI disease, autoimmune disease, infertility, osteoporosis, chronic fatigue, cancer, tension headaches, allergies, and hay fever. And so we think allergies and hay fever, for example, are maybe normal or unavoidable. Really at the root, they often have a dysregulated stress response. So I can't emphasize enough how important it is to be able to evaluate the state of the adrenals and the state of the stress response when you're dealing with any of these conditions. So I want to look quickly here at how this might affect your hormones, and this is in particular important for women because women may suffer from signs of things like PMS or poor sleep or menstrual issues and not really know. Maybe they're given a hormone replacement or they're given a birth control pill to normalize their cycle. But really at the root of it could be just that their adrenals are affecting this, and here's why. So all of women's hormones, we see here progesterone and estradiol, which is the form of estrogen, or the ones that are considered paramount in women's cycles. They come from this precursor called pregnenolone, but also cortisol comes from progesterone. And when you're under a lot of stress, your cortisol levels become paramount. The body needs to produce excess cortisol as a response to stress. What this does, though, is it steals from progesterone. So you may have a low level of progesterone, relative estrogen excess, estrogen dominance, when you're in a stress response. In addition, if this goes on long enough, there will be what's called this pregnenolone steal, where instead of the pregnenolone going to make estrogen, or an adequate amount, it all gets shunted over towards the cortisol pathway, and you can get a relative lack of estrogen. And this is where women might, for example, lose their periods. So you can have a huge imbalance here. You can also affect production of testosterone, important for men and women, not just men. So if you have a hormone imbalance issue, you need to look at what's the state of the cortisol because of this pathway. And we do this with patients often to determine what is the underlying mechanism of what's going on with their physiology to try to help normalize their hormone balance. So what can we do about all this? First thing you can do is have adrenal testing. And this is just an example of a type of test where we test your cortisol level at 4 points through the day, from the morning to the night, and to see what that circadian rhythm looks like. You should have high levels of cortisol in the mornings and slowly drop through the day. And corresponding to, you should feel energized when you wake up in the morning and feel tired when you go to bed at night. But if we have very, very low levels, like you see in this chart, this person is suffering from adrenal fatigue, very low levels of energy. You can also have the opposite in very high levels, where a person is stressed to the point where they haven't yet suffered a breakdown, but they are doing quite a bit of damage to their body. So this helps to know what stage of adrenal fatigue we're in and how we can approach that to maximize the health of the adrenal system. Things that you can do for nutritionally to support your adrenals, typical things we might look at: magnesium, B vitamins, especially B5 and B6. B6 is in particular important for the brain and also for producing neurotransmitters like serotonin and dopamine. Vitamin C and E, Siberian ginseng. Cordyceps mushrooms is a fantastic herb used in Chinese medicine for the strength of the adrenals and the immune system overall. Ashwagandha and other herbs. Pregnenolone and DHEA if levels are very low. Phosphatidylserine is something that helps to regulate the hippocampus and calm down an adrenal stress response. Licorice root if it's low cortisol, and sometimes we might use glandular support. But it's important that you work with someone with these and not just try to do it on your own, because really depending on the results of your adrenal test might depend on which one of these are appropriate, and not all of these are appropriate in all cases. But mostly we want to target the brain because the brain really drives the adrenals. The brain signaling from the brain drives what the adrenals are going to do. To help reduce stress through your diet, you can use these tips. You want to avoid caffeine, especially after 2 p.m. You want to eat low glycemic index foods to help normalize and stabilize your blood sugar. You want to eliminate refined and processed foods. Avoid eating a heavy meal before bed because, especially if it's a high carb meal, your body's going to process that and then you're going to go into sort of a reactive hypoglycemic state, and you may wake up early with a higher than desirable cortisol level in the morning. You want to eliminate refined sugars and carbohydrates and avoid trans fats and fatty food, all things that help to minimize inflammation and regulate your blood sugar. For exercise, weight training is good, but you want to get adequate rest. You don't want to do too much. You don't need to train 5 days or 6 days a week. You want to avoid overtraining. Walking is good. Yoga is excellent. Tai Chi and Qigong is very good. In my clinic, I often give patients Qigong exercises to do to help with their stress response and also muscle stiffness. Jogging, although I wouldn't go running marathons, but gentle jogging is good, and deep breathing exercises are very, very helpful for calming down the stress response. To help reduce stress with your own lifestyle habits, get acupuncture regularly. I can honestly say that with my experience and the experience of my patients, acupuncture is the fastest and best way to calm down a stress response. Nobody ever leaves my acupuncture office feeling like they want to start a fight. They all feel much better than when they came in. Learn to say no. You need to learn to put limits. Don't push yourself further than you can. Don't stress over things that you cannot change. And this is easier to say than do, but as you start to work on the gut and you start to work on your vitamin and mineral levels, this becomes easier to do as well. Make a list of things that you have to do so you don't have to stress over what did you remember, what did you not remember. Make life easier for yourself. Focus on gratitude. Think about the things that are good in your life, not focusing on the negative things. Every day, no matter how bad things are, there's always something that we can feel good about, and focusing on that will help put us in the right frame of mind to minimize our stress response. Find balance in your life, whether that's work-life balance, family balance, with your hobbies. Get a pet. If you can get a pet, they have been proven to help lower blood pressure and calm down people's stress response. It's really an excellent idea. Relaxing sounds or music, especially at night, nice calming music can be helpful. Don't watch the news. There's really nothing but bad news usually on the television news. I would get your information more from internet sources rather than hearing all of the bad news that gets broadcast every night. And pursue a hobby. Everybody needs to have a little bit of fun and something that they're passionate about in life. Even if their job is not something that gives them passion, find something outside of that will make you excited and have passion. So final thought I want to leave you with is that assessing and addressing stress is critical to maintaining and improving your thyroid health. And the reason for this is that if stress is uncontrolled and the adrenals are unregulated, it can be very difficult to improve immune function and symptoms of thyroid dysfunction. So we can help with that with evaluating where your stress response is and how to move forward to address this issue. I want to thank you for watching this. If you have any questions or you'd like to learn more about this, certainly give us a call at the Functional Health and Acupuncture Institute, and look forward to hearing from you.